Good morning. I'm S.Akshana, nursing tutor from ES College of Nursing. I am to here present the topic of infection control. So, infection control. Definition of infection control. The invasion of bodily tissue by pathogenic microorganisms that proliferate, resulting in tissue injury that can progress to disease. So, infection prevention. So, infection prevention refers to the policies and procedure used to minimize the risk of spreading infection, especially in hospitals and humans or animal health care facilities. So, key terms of infection controls are antiseptic, an agent that will inhibit the growth and development of microorganisms without necessarily killing them. Asepsis, freedom from infection or prevention of contact with microorganisms. Autoclaving, sterilization of the article by steam under pressure by using autoclave. So, biohazardous waste, items contaminated with blood, body fluid, secretion or excretion. Contamination, process of becoming unclean. Cross infection, infection transmitted between individual infected with different pathogenic organism. Decontamination, process of removing the foreign materials such as blood, body fluid or radioactivity. Next, moving on to disinfection. Disinfection is a process of destroying pathogens. Infection, a disease state resulting from the invasion and growth of microbes in the body. Infection control, practices and procedures that prevent the spread of infection. Isolation is the separation of infected person from non-infected persons, which will prevent the transmission of infection to others. So, moving on to medical asepsis, it is a state of being free of living pathogens, microorganisms. So, microorganisms, living organisms such as bacteria, fungi and viruses. Nosocomial infection, an infection whose development is favored by the hospital environment. Pathogen, a microbe that is harmful and can cause an infection. Phagocytosis, the injection of bacteria or other material by phagocytosis and amoeboid protozoans. Precaution, an action taken in advance to protect against possible danger, failure or injury. Prophylactic, a medicine or a course of action used to prevent disease. Purulent, containing discharge or causes the protection of pus. Reservoir, the environment in which an infectious agent normally lives and multiplies. Segregation, to separate or isolate from others or from a main body or a group. Sterile field, the area declared free from microorganism or other infective agent. Moving on to sterilization, it is the destruction of all the microorganisms, both pathogenic and non-pathogenic, including their spores. Susceptibility, the condition of being vulnerable to a disease or a disorder. Surgical asepsis, the practice that keep item free of all microorganism and sterile techniques. Transmission, it is a transfer of microorganism, that is, for example, transmission of disease from one person to another. So, moving on to the nature of infection. Microorganisms exist everywhere, that is, in water, in soil and on bodily surfaces such as skin, intestinal tract and other areas open to the outside, that is, example, mouth, upper respiratory tract, vagina and the lower urinary tract. Most of the microorganisms are harmless and some are even beneficial in that they perform essential functions in the body. Example, Enterobacteria produces a substance called bacteriocins which lethal to the related strains of bacteria. So, moving on to the chain of infection. An infection is the invasion of a body tissue by microorganism and the proliferation there. 6 links made up of chain of infection. These are as follows. So, first is the infectious agent, reservoir, then portal of exit, mode of transmission, portal of entry and the susceptible host. So, causative agent. The causative agent is also called the microorganism, for example, bacteria, virus and fungi. Reservoirs, that is a source, a host which allow the microorganism to live and possibly grow and multiply. Human, animals and the environmental can all be reservoir for the microorganism. Moving on to the portal of exit. a path of microorganism to escape from the host: the blood, the respiratory tract, skin and the mucous membrane, genitourinary tract, genitointestinal tract and transplacental route from the mother to the newborn infant are some examples. So common escape routes are as follows: the skin and the mucous membrane, secondly the respiratory tract, gastrointestinal tract, genitourinary tract, reproductive tract, blood and serum. So mode of transmission. So mode of transmission is since the microorganism cannot travel on their own, they require a vehicle to carry them to the other person and places. Infectious disease and even certain contagious disease spread through the following agencies. Their ways of spreading is also given with these agencies. That is the direct transmission. Examples: direct contact, droplet infection, contact with soil, inoculation into the skin or muca, and transplantal vertical. So the portal of entry, a path of microorganisms that get into the new host similar to the post of exit. Susceptible host, a person susceptible to the microorganism. Breaking the chain of infection, a healthcare professional, we cannot provide a healthcare services without some exposure to potentially infectious material, but we can prevent transmission in many cases. The only way to prevent the infection is to break the chain of infection. The nurses must follow a certain principles and procedure to prevent infection and control its spread. So breaking the chain of infection, that is the first chain of infection, rapid and accurate identification of the microorganism. That is, routinely send blood culture, urine culture, skin swab, throat swab, tracheal aspirate culture. Send endotracheal tube tip, urinary cath tip and central line tip for the culture after the removal. Moving on to the second point, control or elimination of infectious agent, including the proper cleaning by the water and mechanical action with or without detergents. So disinfection, that is a sterilization of a contaminated object. So high level of a disinfectant, that is the activated glutaraldehyde, that is Cidex 2%, sodium hypochlorite 1%, carbolic solution 5%, bleaching powder 1%. So moving on to the low level of a disinfectant, that include methylate spirit, that is 70%, betadine solution 10% and Savlon 1%. So breaking the chain 2 of infection, the second stage. So measuring to control or eliminate of reservoir of infection, that is the employee health, immunization of the health personnels, example hepatitis B vaccination, regular checkup for early detection of any communicable diseases, restriction from the work of the patient contact when infected with the other communicable diseases. So environmental disease, cleaning with the hospital approved cleared disinfectants, example phenol, through cleaning of a bed and the bedside equipment before admitting the new patient. Separate mops should be used for cleaning the unit, that is twice a day. So damp dusting should be done and drains should be patent. So handling of the linen, keep the bed sheet dry and clean. Change the sheet every day. Do not shake blanket and linen. Do not throw them on the floor. Soiled linen counting should be done in the separate place. So next, moving on to the pest control, measure to be taken to avoid the entry into the unit. That is example, the proper cleaning, sealing and draining should be done. The patient diet should be kept in covered container. Keep fly trappers on each side of the bed of the patient. Pesticide spray should be used weekly. So visitors control should be made in each and every unit. The traffic should be restricted except for the doctors, nurses and the supportive staff. Allow only one attender 3 to 4 hours. Keep the doors and windows closed. Mobile phone should not be allowed inside the areas. Machine, that is X-ray, echo machine, ultrasound machine from the outside should be cleaned with the spirit before their uses. So breaking the chain 3 of infection, that is the portal of exit. So practicing aseptic precaution is must during the patient visit. Avoid talking directly into the patient's or a client mouth to prevent the droplet of infection. Wear of mask is compulsory if the nurse is infected or she is dealing with the patient who are infected. Carefully handling of waste like urine, feces, MSS and the blood is important. Disposable gloves should be worn to prevent the direct contact with the waste or infected material. Moving on to the breaking the chain of fourth infection, that is a mode of transmission. Contact precautions, single patient room, staff to perform the hand hygiene, put on gown, apron and the gloves prior to the entering the patient room and when anticipating contact with the patient and their surroundings. Removing the gown, apron and the gloves and perform hand hygiene after leaving the room. Clean and disinfect non-disposable equipment and items when removed from the patient room. So, droplet precautions. Single patient room, staff to put on the surgical mask when entering the room and remove and dispose of the mask after leaving the room and perform the hand hygiene. Instruct the patient about the respiratory, hand hygiene and the cough ethics. Limit the patient movement outside the room to medically necessary purposes. Patient to put on a single surgical mask when leaving the room. Precautions of airborne infection. Single negatively pressure room, door to remain closed. Staff put on N95 mask or P2 mask when entering the patient room and remove and dispose of mask and perform the hand hygiene after leaving the room. Instruct the patient about respiratory hygiene and the cough ethic. Patient to put on the surgical mask when leaving the room. So, breaking the chain of fifth infection, that is the portal of entry, maintaining the integrity of the skin and mucous membrane. Prepare precision for tubing, etc. may prevent the injuries of the skin breakdown. Turning and positioning of a debilitated clients. Ensure the personal hygiene of the client regularly. Proper disposal of contaminated syringe and needle. Proper handling of catheter and drainage set, etc. Care should be taken while collecting and handling the specimen. Breaking the chain 6 of infection, protecting the susceptible host. Protecting the normal defense mechanism by regular oral hygiene, maintaining adequate intake, encourage deep breathing exercises, encourage the proper immunization of the children and adult client. Maintaining the healing process, promotion of intake of well-balanced diet containing essential protein, vitamin, fat and carbohydrate, institution measures to improve appetite of the patient, helping the client to identify method to relieve stress. Pathogen fall into two broad categories, that is bloodborne carried in the body fluids and airborne which is carried through the air. Standard precautions containing following things, that is hand washing, gloving, gowning, mask, protective eye wear, cap and shoe cover. So thank you.